Good morning. My name is David Alvaro for Pharma's Almanac. We're here exploring the future of healthcare on the road to 2021. This morning we're here on the banks of Lake Michigan, and I'm joined by Marcus Schabacker, President and CEO of ECRI and Chairman of the Board of the Institute for Safe Medication Practices. Well, good morning, Marcus, and thanks for having us here today.
Morning, Dave. Pleasure to have you.
So I guess since we are socially distanced, we can take off our masks and proceed with the interview.
Okay.
So Marcus, for those who might not be familiar with the work that you do, what can you tell us about ECRI and about ISMP?
ECRI is a 50-year young, independent, non-for-profit organization which mission is to advance evidence-based and effective healthcare globally. ISMP is a wholly owned subsidiary of ECRI, and ISMP is focusing on the prevention of medication errors in all care settings. And what we focus on at ECRI is really threefold. We evaluate medical technology independently. As I mentioned, we are non-for-profit, we're membership-based. We provide our clients and members with independent evaluations of medical devices. The second part is we're really focusing on clinical evidence and clinical research, evaluating and grading that clinical research. And lastly, together with the ISMP, we're the largest independent patient safety office in the country and probably the world. So we're really focusing on advancing safe medical practice, taking care of patients in the sense of that we enabling healthcare providers, insurance companies, government agencies to do the best for the patients. We're also working closely together with manufacturers in the sense that manufacturers can have access to our work products and use our data we generate in the labs and our clinical evaluations to guide their development programs and their product safety, quite frankly. And particularly, ISMP is focused on the medication error prevention, as I mentioned. So how do you design processes in the hospital, in the pharmacy? How do you design product labeling and product packaging to reduce medication errors?
So as an organization that's focused on improving patient safety and medication safety, what can you tell me generally about, what's being done wrong, what's going wrong now in healthcare, and, what we can do about it, including maybe any innovations that may help increase, patient safety?
Preventable medical errors is the third leading cause of death in the United States, only after cancer and cardiopulmonary diseases. And about 30% of those are due to medication errors. And they're causing about 150 to 300,000 preventable deaths, right? So that's an enormous number. So that's a real problem we're trying to solve for. And it's going to take all players in the healthcare system to improve on that. It's how do you practice medicine? How do you use the medical devices and medication and drug packaging? How do you develop those with safety in mind? And then how do you learn from mistakes which have been made? And that's really where ECRI and ISMP can come in, because both organizations, ECRI focused on all aspects of the healthcare delivery, ISMP particularly focused on medication error prevention. We have an enormous database through our members and clients who report back to us if there's any problems with medical devices, clinical practice, or drugs. And we collect those, we analyze those, and then we redistribute it to our members. And that's a tremendous wealth of knowledge we have. And with that, we can then advise organizations through, for example, the Medication Safety Board, how to design safety into a product when you think about labeling, when you think about packaging, when you think about instructions for use. And from an innovation perspective, I think the digitalization has brought great opportunities, but there's additional risks. With computerizing everything, the copy-paste issue is a big thing, right? Because you're making very easily mistakes in the electronic medical record system. How do you make sure that the patient you want to give the drug to is really the patient who should receive the drug? So those are areas where we can really provide a lot of innovation, and we can provide the input through the Medication Safety Board so that companies in all aspects of the healthcare system can develop better products.
So Marcus, a big part of this campaign for us is, speaking with and picking the brains of leaders and experts like yourself to try to anticipate some of the transformations we're going to see in healthcare over, the coming decade and beyond. So what can you tell me about, how you envision the future of healthcare?
David, I've been in healthcare for 35 years. The past 5 years, but particularly the last year, has provided changes like I haven't seen in 35 years before. Right? And some already started before even the pandemic hit, but certainly accelerated through the pandemic. And that in particular is the change of healthcare setting. It's moving out of the hospital into the non-hospital arena. Ambulatory care centers, ambulatory surgery centers, cancer center, infusion centers, but even into the home. Right? Aging services, long-term care facilities, all those are new areas of care. The other aspect is certainly that care is going to be delivered by less sophisticated and trained personnel, either home services or lay helpers, family members, or the patient themselves. That also necessitates innovations in how we monitor patients, right? Because they used to be in the hospital, we could go in there, we could check them, we could put them on a monitor. Not so anymore, right? They are miles away, we don't have direct access to them. How do we supervise and monitor? How do we ensure compliance with treatment? So those changes, and not to mention digitalization, where we talked about this a little bit earlier, lots of opportunity, lots of risk associated. And then a third component I would add is really the dramatic shortage of healthcare providers. In 2025, we anticipate to have a shortage of about 1 million nurses and 150,000 physicians. Put that into context of that we all get older, we get more diseased, more complex diseases. Now you take that into a healthcare setting, which is much less controlled, quality ensured that we used to. And we talked before, even in this highly regulated, highly controlled environment, we have significant problems. Can you imagine what's going to happen in the home? So that will require all players in the healthcare system, again, to really collaborate and work together. Medical device companies, drug companies have not, to a large extent, designed their products for home use or lay use. They have designed and developed those products for expert use.
So the COVID-19 pandemic has certainly thrown all of healthcare and all of society really into a tailspin. What are ECRI and ISMP doing to help pharmacy and healthcare leaders to deal with this chaos and confusion?
Certainly be unprecedented challenges for society, but healthcare in particular. ECRI realized very early on that this was different. We needed to be upfront and be proactive around resources we made available regarding COVID-19. And as early as February, we started to make information available to the public at large, not just to our members and clients, about, and we call it the COVID-19 Resource Center. We really initially focused on PPE, the personal protective equipment, masks, gowns, gloves, because there was a critical shortage very quickly. And what we do is we do functional equivalent test. We provided information about available sources and prices, but more importantly, even availability, because at that time it was already critical. We then continued to work with institutions, caregivers, healthcare providers on critical issues like ventilators, infusion pumps, and how to safely apply them. So healthcare workers, because they didn't have the right protective equipment, were trying to move pumps into the hallways, infusion pumps. So all the sorts of problems resulted out of this. We dealt with and gave clear assurance on what to do and what to do in combination between ECRI engineers and ISMP pharmacists, because there's quite a bit to consider, not just from a mechanical perspective, but also from a drug perspective.
Well, Marcus, thanks again for helping us understand how ECRI is approaching the future of healthcare and for allowing us to make this lovely stop here on the road to 2021.
Well, thank you. Thanks, David. Thanks for coming out and having interest in ECRI and ISMP and the Medication Safety Board.